The coronavirus. A lot of people are worried, and it seems like some people are a little bit scared too. When I'm scared about stuff, what I like to do is research that thing I'm scared or worried about just a little bit more. Knowing more about something usually helps me calm down a bit and feel a little bit better about things. So I think that's what we're gonna do today. What is the coronavirus? Well, the coronavirus is a virus. It has a name, SARS-CoV-2. So if you read an article and it says SARS-CoV-2, it's referring to the virus itself. If you become infected with SARS-CoV-2, you develop a disease that they've named COVID-19. SARS-CoV-2 is the virus and COVID-19 is the disease. Those are the fancy names, but in general, people just call it the coronavirus. All right, where did it start? It started in Wuhan City in China, which is right here. What are the symptoms of the coronavirus or COVID-19? The symptoms are kind of like you have a cold. Fever, tiredness, and a dry cough. It's possible to develop additional symptoms like aches or nasal congestion or a sore throat. Still generally just kind of like a cold. How dangerous is it? This is a good question. 80% of people who catch the coronavirus recover without additional medical help. So they recover on their own. 20% of people need medical attention. They need to be taken to a hospital or to see a doctor, which may seem pretty high, but here's something to keep in mind about those statistics. Most of that 20% are older people who have pre-existing health problems. So they have compromised immune systems. They're like already sick. Usually if you're an adult or a kid, you're probably just going to experience those common symptoms. How does it spread? It's most often transmitted through tiny little droplets in the air. If someone is infected with the coronavirus and they cough or exhale, the virus could potentially be on little droplets that are suspended in the breath that they breathe or cough out. If you breathe that air in, then you can become infected. It can also be transmitted if someone who is infected coughs on like an object or a surface, and then you touch that, and then you touch your face or your nose or something like that, then you could become infected. That's how the disease is transmitted. How can I make sure that I don't catch the coronavirus? Great question. There are a few basic things that you could do. One, wash your hands. But this is very important. Wash your hands with alcohol-based hand scrub or sanitizer. Viruses are not killed by soap. Viruses are killed by alcohol-based sanitizer. So use alcohol-based sanitizer. Another suggestion, maintain distance from anybody who's coughing or exhibiting symptoms. You see somebody who's coughing, just stay away from them so you don't breathe in their coughy air. And finally, avoid touching your eyes or your nose or your mouth very often because those are access points for the virus to get inside your body. Should I wear a mask? This is a great question. To quote the World Health Organization, here we go. Only wear a mask if you are ill with COVID-19 symptoms or looking after someone who may had COVID-19. So only wear a mask if you are sick or looking after somebody who is sick. Disposable face masks can only be used once, and if you are not ill or looking after someone who is ill, then you are wasting a mask. There is a worldwide shortage of masks. So the World Health Organization urges people to use masks wisely. Because there's a worldwide shortage of masks, it might be best to leave the masks to the people who really need them, like doctors and nurses or people who are already sick. I'm not a doctor, I'm not a medical professional, I'm just somebody who's moderately good at researching things on the internet and communicating them to other people. It's really easy to get kind of worked up in the global panic, and when I researched this stuff, it kind of helped me at least understand it a little bit more. Here's Charlie talking, we're putting facts aside, now we're in the opinion-based section. It seems like what's going on is a really nasty cold is spreading throughout the world very quickly. Most of the people who catch it are gonna be fine. I think if I catch it, I'm probably gonna be A-okay. But the fact is that some people who catch it could potentially not be okay. To help make sure that they're safe, it might be good to make sure that we do everything we can to prevent any spreading of the disease. So clean your hands with alcohol-based hand sanitizer. Maintain a 3 feet berth away from anybody who's coughing a lot. And man, if you're sick, just stay home, dude. This happens, I feel like the most considerate thing you could do when you're sick is to stay away from other people to make sure that they're not sick. That's pretty much it. I felt a little better about things after doing this research. I hope you do too.